Hello, so this is my assignment for um, healthcare organizations. So, depending on their size, type, and specialty, healthcare organizations are dispersed in different ways around the country. The most typical types of healthcare organizations and how they are distributed, I will read out. So, hospitals are spread out all over the country, with bigger cities often having more hospitals and rural areas typically having fewer. In the United States, there are over 6,000 hospitals. Clinics are frequently concentrated on delivering primary care or specialty services, such as dentistry, mental health, and are typically much smaller than hospitals. They're dispersed all across the United States, many of them in populated areas. Federally qualified health care centers are clinics that offer primary medical treatment to low income people and are funded by the federal government. In the United States, there are over 1,400, which are mainly found in underserved rural neighborhoods and rural locations. Home health agencies are for patients who are unable to leave their homes. Home health agencies offer in home care. They are dispersed across the United States, and many of them treat people who are old or disabled. Hospice treats patients with terminal illnesses um, and receive end of life care from hospice. They are dispersed around the United States and frequently collaborate with hospitals and home health organizations. Health insurance providers, obviously, these businesses offer insurance protection for medical services, and they are dispensed all across the United States, and many of them give coverage to particular groups or geographic areas. So, overall, the distribution of healthcare organizations around the United States reflects the healthcare requirements of various demographics and geographic areas. The size and areas of interest of these organizations vary greatly, but they all play a crucial part in ensuring that Americans have access to healthcare services. And for the other part, I wanted to just talk about Alabama. There are over 90 hospitals in Alabama, including both urban and rural ones. According to the Alabama Hospital Association, of these 90 hospitals, 52 are urban and 38 are rural. There are also 137 rural health clinics. Alabama's rural hospitals face difficulties such as lack of access to specialized medical treatment, um, including the trouble of luring and keeping medical specialists and financial strains brought on by lower patient numbers and greater proportions of uninsured patients. Alabama's urban hospitals must contend with issues like rising patient loads, increased patient competition, and rising demand for specialized treatments. Despite these difficulties, hospitals in rural Alabama, rural area, and urban areas are essential to the state's population access to healthcare. While urban hospitals offer specialized care and act as regional referral centers, rural hospitals are frequently the only healthcare option for residents of rural areas. Like other states in the United States, Alabama has socioeconomic and healthcare inequities, especially for underprivileged and marginalized groups. So, to go on with the socioeconomic disparities, the poverty rate of Alabama is 15.6%, which is greater than the national 10.5% average. The highest 20% of the owners in the state make about 4.2 times more than the bottom 20% of earners, indicating a significant level of income inequality in the state. Additionally, there is a substantial racial wealth inequity in the state, with white households controlling 86% of the wealth, while black households only own 4% of it. And to go further into detail with the healthcare disparities, there are major healthcare disparities in Alabama as well. 10% of the population lacks health insurance, making the state one of the worst in the nation for uninsured people. In many of the state's rural districts, access to healthcare providers is also constrained. Um, Heart disease, diabetes, and obesity are among the highest, or among the chronic diseases that are all over in Alabama in high rates. They're very prevalent. So services not available. Reproductive healthcare services such as abortion, which are severely regulated by state law, and are some services that are not available in Alabama or have limited availability. Furthermore, the state does not provide LGBTQ plus people with extensive anti-discriminatory safeguards. And lastly, Alabama was not one of the states to extend Medicaid, denying many people with low incomes access to healthcare. So thank you. I hope you enjoyed the presentation.